everyone, my name is NurseB. Today's lesson, we are going to talk about fluid volume deficit. Fluid volume deficit is when the body loses more fluid than it takes in. Fluid volume deficit include hypovolemia and dehydration. Hypovolemia is a loss of fluid and electrolyte from the extracellular space, that is the ECF, and dehydration is only water loss without electrolyte. Dehydration results in increases in lab levels. For instance, sodium, BUN, hematocrit, glucose, protein, and urine-specific gravity all increases, and possible low blood pressure due to decrease in blood volume. In this situation, the sympathetic nervous system will respond of an increase in taste, and this will lead to the release of antidiuretic hormone for compensatory mechanisms in order to prevent complication from loss of fluid in the body. Now, let's look at clients at risk for fluid volume deficit. Clients at risk for fluid volume deficit include older adults due to unable to obtain or access fluid independently without help. Patients with diabetic insipidus or diabetic mellitus experiences frequent urination and increase in taste. Watery diarrhea, frequent vomiting, and diuretic overuse. Excessive bleeding after a procedure or surgery, and GI fistula draining. Also, patients with altered mental status may not be able to communicate fluid needs. Decrease in antidiuretic hormone might lead to dehydration. Last but not the least, long-term tube-fed patients who are NPO, that is nothing by mouth, are serious risks for fluid volume deficit or dehydration, especially without enough supplementary water with the tube feeding. Now, let's look at nursing assessment. Nursing assessment includes decrease in skin togo, not valid assessment for older adult patients, low blood pressure, which can lead to shock, high urine-specific gravity, decrease in fluid volume results in rapid heart rate, tachycardia, because when the body is dehydrated, the heart will have to work harder to pump blood. Priority: encourage PO fluid if not contraindicated. Infuse IV fluid like isotonic fluid as per ordered by the physician. Assess level of consciousness. Record intake and output. Document vital sign and daily weights. This brought us to the end of this video. Fluid volume excess is coming out soon. Stay tuned. Please consider to share, like, and subscribe. Thanks for watching, and bye for now.